Hi everyone, I'm Stephanie with 9Health. Today we're talking about vaccines, specifically the COVID-19 vaccine and the development of that. It's Immunization Awareness Month as well, so I thought it was a good time to kind of bring up that topic, talk about the latest news, and just get an update on how the development of a vaccine works and try to understand that whole process. And I've brought in some experts. Dr. Thomas Campbell is an infectious disease physician at the University of Colorado Hospital and CU School of Medicine, and 9Health expert Dr. Payal Kohli, who's a cardiologist, but also an expert on internal medicine and preventive medicine. Thank you both for joining me today. First, Dr. Kohli, the race to be first with the COVID-19 vaccine continues. Can you tell us the latest developments?
So Moderna, which is a manufacturer of the top runner vaccine, has started enrolling for its phase 3 clinical trials. And the goal is to get 30,000 patients. And in the first 3 weeks, they've already had a blockbuster enrollment with over 8,000 patients enrolled. In fact, the company is now saying that they're instructing their sites to slow down enrollment. And the reason for that is because they want to try to get the right type of patients enrolled in the clinical trials. So we know that coronavirus cases in the community, Black and Latino populations represent greater than 50% of the cases in the community. So we want a really good representation of this population in the vaccine trials. And thus far, we only have 15% of the enrollees being Black or Latino, so only about 5% Black and about 10% Latinos. So they really want to try to enrich this minority group in order to try to, have a good representation and a diverse enrollment within the trial so that we can get really real life results that can be translated. So it's all very exciting that the enrollment is going so well. The fact that they are enrolling so fast and on track with their timeline means that they'll probably complete enrollment in about the next 6 weeks or so, possibly a little longer. But as soon as we complete that enrollment, we can then start collecting that data and really look to see how things are working.
And Dr. Campbell, again, you're with UC Health, University of Colorado Hospital, and CU School of Medicine. You're working with a team for the phase 3 study of Moderna's vaccine for COVID-19. Can you just tell us more about the work you're doing and how that's going?
Sure. We are one of the approximately 89 sites across the country that are enrolling to the Moderna study. And actually, we are beginning enrollment today. So our very first participants will enter the study this afternoon. So we're very excited by that. As Dr. Kohli has said, enrollment of the right participants is priority. And with a disproportionate amount of COVID-19 illness that occurs in our Black, Hispanic, and Native American populations, we really want to enrich our group of study participants for individuals from those communities.
Yeah, and I know you're looking for about 1,000 people, right? Can anyone just join? This is just kind of a follow-up to that, but can anyone just join the trial?
Yeah, so we don't have a cap or a fixed number, and we will enroll as many patients as we can, as long as we feel that we're doing it safely and with good attention to detail. So we will start off slow and gradually ramp up enrollment over the next week or so. As Dr. Kohli mentioned, enrollment nationwide is going very briskly, and the enrollment to the study will end when nationwide enrollment gets to 30,000. So our plan is to enroll as many participants as we can until the study is fully enrolled.
And Cheryl on Facebook just asked this, so I'm just going to pass it along to you quickly, but she said, who created the vaccine? What's in it? I think that's a question people always have. Whenever we talk about the flu vaccine, and people always talk about the ingredients of a vaccine. Can you answer that kind of question? What's in the vaccine?
Sure. So the Moderna vaccine that is being tested is a unique vaccine. It's a type of technology that so far is not being used in any licensed vaccine. So typically when we get a vaccine like, say, the flu shot, what we receive is an injection of killed flu virus. So that is flu virus that's grown in the laboratory and then killed and then given to us by an injection into our muscle. Another common vaccine is, for instance, the what's called the Shingrix vaccine for prevention of shingles, which is a clinical illness due to the chickenpox virus. And in that case, there is a specific protein from the chickenpox virus that is given. So it's not the whole virus, it's not a killed virus, it's just part of the virus. So the Moderna approach goes a step beyond that. And what's given is not a protein molecule at all, but what's given is a nucleic acid molecule called a messenger RNA. And that messenger RNA, once it's injected into the muscle cells, programs those muscle cells to make the coronavirus spike protein. And then the body's immune system forms antibodies that will hopefully protect against infection. So it's a very unique technology. And if it proves successful for this coronavirus vaccine, it will be a major step forward in the vaccine field in general.
Yeah, again, it's just, a big puzzle piece that everyone's trying to put together right now and get this all solved so we can have a vaccine ready. Again, August is Immunization Awareness Month. Obviously, the vaccine getting a lot of attention right now is the development of COVID-19 vaccine. So I wanted to talk to a couple experts about that. Dr. Kohli, so, some people still out there still think that, maybe a vaccine's not the answer. We should all just get it, achieve herd immunity. Can you talk a little bit more about what it takes to achieve herd immunity with COVID-19?
I'm really glad you brought that up, because COVID parties or get-togethers where people are intentionally trying to catch the infection are very dangerous, and they're very ill-advised at this time. So let's talk for a minute about what herd immunity is. So when no one in the population is immune to a disease or a virus, it can spread very quickly. But if some percentage of the population is immune to the virus, it actually slows the spread of the virus, because the virus has a harder time finding a viable host. So even if you're not immune on an individual level, just by being part of a community or a herd where there are other individuals that are immune, can be relatively protected, and the virus, spread will be slower. So your exposure risk is lower. So that's what the concept of herd immunity is. Now, this was a failed experiment that Sweden tried, where it was, let's all go out and get sick from the virus and develop herd immunity as a way to kind of get over this pandemic. And it failed for a few reasons. Number one is because in order for this to work, at least 60 to 70% of people, that's what they call the herd immunity threshold in the herd, have to be immune. Now, there's a new paper that came out in Science, the journal Science, just last week that said that herd immunity threshold may be a little lower, perhaps around 43%, but that's still a lot of people. So 43% or more people in the population have to be immune to the virus in order for herd immunity to work. And in order for that to happen with natural infection, that's going to be a lot of people that have to die, because some percentage of the people that get infected are going to die. The second is that it's based off the assumption that the immunity lasts. So, we're learning from new studies that antibodies can start to wane as early as 20 to 30 days after natural infection, sometimes after 2 months or so. And the antibody response may be variable for different individuals, possibly related to the intensity of their initial infection. So getting infected and getting herd immunity is not even a guarantee, because you may not have a robust antibody response. And even if you do, in some individuals, it may start to wane after infection. So then that herd immunity kind of runs out, even if you've had the infection. So natural infection is a very dangerous way to get herd immunity, and it's not a good idea. On the other hand, vaccination is an excellent way to achieve herd immunity, because you're, number one, able to do it in a widespread controlled fashion. So you're able to administer it to more people. You don't have to pay the price of death. So you don't really have to lose lives along the way in order to develop that herd immunity. And if these responses start to wane, you can think about booster vaccinations. You can think about a second vaccine, as we've seen with the Moderna trial, which includes 2 doses of the vaccine. So there are many ways in which vaccination can effectively confer herd immunity, and that's one of the ideas of getting widespread vaccination.
And Dr. Campbell, again, you're working on the Moderna trial at University of Colorado Hospital. Can you just talk a little bit more about steps to vaccine development? This seems to be going pretty quickly. Should we be concerned about the speed this vaccine's being developed?
Yeah, so vaccine development typically takes a long time. The record in the past has been, I think, 4 years, and typically it's even longer than that. And the reason for that is that there are a number of processes that have to happen and they're usually done one after another, so in series rather than being done at the same time in parallel. And with the urgency to get a effective and safe COVID vaccine, that timeline has been compressed in a way that allows some of these processes to happen more in parallel rather than one after the other. And by doing that, in no way does that compromise safety, because the same processes that would be happening in a normal situation are still happening, but they're happening in a shorter timeline. The second part of what's being done is to start preparing for production of the vaccine even before the vaccine has been proved safe and effective. So the U.S. government is making an investment in the various vaccine companies that are developing potential vaccines, so that they'll be ready to start producing the vaccine once it's shown to be safe and effective. But the same steps, what we call phase 1, phase 2, phase 3, which evaluate the safety and the efficacy of the vaccines in increasingly larger groups of people, those are still being conducted. But we're conducting them in a way that allows it to happen faster than we've ever done before.
And this was big news last week, just speaking of fast. What are your thoughts on the Russian vaccine?
Well, I would say that is an example of what we don't want to do in this country. We don't want to shortcut the process and skip steps. And so from what I know about what's been reported about the Russian vaccine is they've skipped one of the most important steps, which is the phase 3 step, which is what we're entering now with studies like the Moderna vaccine study. And in the phase 3 process is very important because it involves enrollment of large groups of patients. As Dr. Kohli mentioned, 30,000 people will be enrolled in the Moderna study. And it's important to have very large groups of people enrolled and followed over long periods of time to make sure that the vaccine is both effective and, most importantly, safe. And when you skip that step, you can't demonstrate either of those important outcomes. And unfortunately, that's what's happened in the case of the Russian vaccine.
And Dr. Kohli has to leave us in a few minutes, so I want to give her a chance to maybe add to that. And then also just, Dr. Kohli, do you think having a vaccine will end this pandemic? I know there's a lot of people out there in our country still that are against vaccination. So do you think having a vaccine will end the pandemic?
I think that's a really important question, Stephanie. And preliminary studies of the American population are saying that 40 to 50% of Americans are saying no, or saying that they're unsure about whether or not they'll get this vaccination. Partly some of that comes from fears of catching the virus from the vaccine. Some of it comes from fears of the fact, what we just discussed earlier with Dr. Campbell, that people are feeling that the research has been rushed. So I think it's critically important to talk about the fact that only widespread vaccination is one of the only ways out that we have of this pandemic. And even when the vaccine does become available, it'll still take 1 or 2 years of us living in this kind of modified world that we're living in before there's widespread distribution, administration, development of immunity, and before we can really start to relax some of the mask wearing, the social distancing, some of the changes that we've now incorporated into our lives. But if we want to get out of this, vaccination is the best way to do it. And we have been able to eradicate some diseases like smallpox due to widespread vaccination. That's not to say that we can necessarily eradicate this virus, because a lot of things have to happen in addition to vaccination in order for us to do so. But if we really do want our lives to get back to normal, I can't encourage everybody enough to seriously think about getting this vaccine, even if you're one of those people who doesn't otherwise get vaccines for other infections. And if you're one of those anti-vaxxers, please talk to your doctor about your concerns and why you have those concerns and how this vaccine fits into that spectrum. Because without widespread adoption, with just few people getting the vaccine, it's not going to really have the effect that it needs to have.
And someone just said, Katie said, what about sunlight, vitamin D, zinc? So there are some preventive things, and we've talked about this before, that you can do to make sure you're the healthiest version of yourself. So if you do get sick, you can at least fight something off easier, hopefully. So prevention is always important.
Absolutely. And I just want to say one more comment about vaccinations, which is that in general, and this is kind of pivoting into the flu before I go, I want to make a pitch for the flu vaccine as well this year, because three reasons, and I call them the 3S reasons. So first is the selfish. You want to do it for selfish reasons. So you do not want to get the flu this year, because if you do, everyone's going to assume that you have COVID-19, and they're going to keep you out of work and keep you away from family. And if you end up in the hospital, you'll probably be on a rule out COVID ward. On top of that, you do not want to have the possibility of getting two infections at the same time, the flu and COVID-19, because that could really be disastrous for your body. The second S, I call it a selfless S. So that's to really for your community. The healthcare system really needs to focus this year on putting its resources to work to fight the COVID-19 pandemic. So we need to keep that flu burden down, and that vaccine is really going to help us to do that. And then the third S, I call it the scientific S. So vaccines in general work to not just fight off the virus that you're vaccinating against, but they also sort of rev up the immune system and can help with other respiratory viruses as well. So the BCG vaccine is a good example of a vaccine that's meant for TB or tuberculosis, but it revs up your immune system and can decrease the incidence of other respiratory infections as well by activating an arm of your immune system called the innate immune system. So three really good reasons to get the flu vaccine. The social distancing, the masks, all of that is hopefully going to help also keep the burden of flu down in our community. But those vaccines this year for the flu are more important than ever. And as you've heard just this morning, many school districts, such as in Massachusetts, are mandating now flu vaccines for our kids as well before they can return to school.
Yeah, some are calling it a twindemic. So we definitely want to avoid overloading our system, and yeah, getting sick with two different viruses would not be fun for anyone. Thank you, Dr. Kohli, for joining us. I think you have to hop off. So thank you for that advice on the flu vaccine. Dr. Campbell, I don't know if you want to add to that as well. I wanted to ask you about, while we're on the topic of vaccines, just about this concept of a twindemic and avoiding, a bunch of people also getting sick with influenza this fall.
Yeah, no, I agree completely with all the points that Dr. Kohli made about the overwhelming reasons to get vaccinated for flu this season. What I would also add to that is that if we have a large outbreak of flu, that in the era of COVID, that will place an even greater burden on our healthcare system. And as Dr. Kohli was alluding to, the symptoms of flu and COVID are very similar, and clinicians like us cannot distinguish between those two illnesses just based on symptoms alone. It requires testing, and as we've seen, there is a lot of demand for testing, and in many cases, it's exceeding our capacity to do the testing. And so if we have an outbreak of flu, that will lead to an even greater number of people who have COVID-like symptoms who then need to be tested, and will put a great demand on an increased demand compared to what we're seeing now on our testing capacity. And if the testing capacity is overwhelmed, then we're going to have very long lines. We're going to have delays in getting results. We'll have shortages of the reagents that are needed to do the testing. So I fully endorse everyone getting a flu vaccine this season.
Yeah, and with 9 Health, we will be offering flu vaccines at we're going to do some fall fairs, some smaller fall fairs this fall, and we'll be offering vouchers for flu vaccines or free flu vaccines. So stay tuned for more information on that, and I'll provide that information when I have some more. But Dr. Campbell, I'm just looking through Facebook at a couple of the other questions. Someone said Moderna had an 80% adverse reaction in phase 2. I don't know if you can talk about that, or just talk about what phase 2 was, or if there's any accuracy to that person's comment.
So as I mentioned earlier, there are different steps in the development and the demonstration of the safety and efficacy of any vaccine. and those are divided into phase 1, 2, and 3. So the study that is currently being conducted for the Moderna vaccine is the phase 3 step. The phase 1 part of Moderna evaluation for their vaccine, the results from that were published in the New England Journal of Medicine a few weeks ago. And in that publication, a significant proportion of people had what we call reactogenicity to the vaccine. And what that means is symptoms such as pain and swelling at the injection site, or sometimes more systemic symptoms like fever or chills or muscle aches. So we see this commonly with vaccines, including vaccines that are used and that we know are safe and effective. Even the flu vaccine can cause those type of symptoms. Those type of symptoms are short-lived. They only last for a couple of days or so. And in fact, that's what was seen in the Moderna phase 1 data that has been published. The phase 2 part of Moderna is still ongoing. And as far as I know, those results have not been made public yet. So I'm not aware of those results.
Okay, thank you for clearing that up. Emily, we talked about this a little earlier. Emily on Facebook asked, is there a way to volunteer for the COVID vaccine? Again, you're looking for participants in, certain categories, I guess. You want to have ideal participants in the study. Talk a little bit about how people can help if they want to help with the progression of a COVID vaccine.
Yeah, absolutely. So the intent is to enroll people who, because of their occupation or where they live or other parts of their environment, are at risk for getting SARS-CoV-2 infection. So SARS-CoV-2 is the virus that causes COVID-19. And so people who are in the healthcare professions, people who live in high density settings and high rise apartment buildings, people who work in retail establishments where they are exposed to large numbers of people on a daily basis, first responders, police officers, paramedics, firemen who are in contact with people in the community on a daily basis. So those are some of the groups of people that we want to enroll in this study. And as been mentioned, people from our Black, African American, Hispanic, Native American communities oftentimes have those type of jobs that put them at risk for SARS-CoV-2 infection. And so we in particular want to make the study available to people from those communities. So anyone who wants to participate can contact me at the University of Colorado, and I can put them in touch with the right people.
Perfect. So I can put your info below for people to contact you?
That's right. You're
Okay.
welcome to put my email address, my telephone number.
So if you have any other questions too, everyone, you can email John Campbell, Dr. John Campbell, and ask him as well. I'm going to let you go. I've kept you, I think, longer than I said I would. If we have any additional questions, you can post those in the comments and I'll try and get those answered by Dr. Kohli or Dr. Campbell. Before we go, I want to make sure that everyone knows that 9Health is offering preventive health screenings right now. You can go to 9healthfair.org and sign up for those. The same screenings we normally would offer at the 9Health fairs are now being offered at Quest Diagnostics Patient Service Centers. So $35 for your blood chemistry screening gives you a good baseline of health, just to kind of see where you're at, see where your levels are at. And if you have a medical question that you need answered, or you know someone that doesn't have access to the internet and has a health question, they can call 9Health Neighbors, which are 9Health medical volunteers. They're staffing a line and calling people back within 24 hours. It's 303-698-4455, extension 2005. So you can leave a message and they'll give you a call back within 24 hours. You can talk to a real person. Dr. Campbell, thank you so much for joining me. And again, Dr. Kohli had to leave us a little bit early, but I want to thank you, and we'll sign off from here. Thanks so much.
Great. Thank you very much.